Hello, I'm Dr. David Levine, and today's date is April 29th, 2023. I'm in Chicago at the American Association of Plastic Surgeons meeting where I'm doing interviews for the ICON project. The purpose of the ICON project is to preserve in audiovisual format icons of our society who are teachers, innovators, forward thinkers, and great surgeons who advance our specialty. I hope you enjoy this. Hello, I'm Dr. David Levine, and I'm here to interview Dr. Scott Bartlett for the ICON project. Dr. Bartlett, thank you for coming. My first question, simple. Full name, date of birth, if you're so inclined.
Scott Paul Bartlett, June 29th, 1950.
Okay. Parents' name?
Frank and Beverly Bartlett.
Okay. Tell me a little bit about your parents, if you would. What your father did and your mother did.
Yeah, I grew up in Utah. I was born and raised in Ogden, Utah. My father raised rabbits for a living. I know that's an unusual profession, but we had a large rabbitry, and he raised rabbits for a living for both the meat and the furs that were sent back east for furs. And my mother was a housewife.
Okay. So you're born up in Utah. Tell me a little bit about how many children you have, if you do, and grandchildren. You mentioned their names.
Yeah, I have 2 children at present, no grandchildren or great-grandchildren, Natalie and Alexandra. I'm very proud of them. I feel they both finished college and graduate school. They're gainfully employed and very independent.
Okay, well, good. Are there any association with medicine with them at all?
No, I think they saw how much I was gone and opted out of the medical field.
Fair enough. Fair enough. Yeah. Your wife's name. I mean, how did you meet your wife? You gave me her name, yes.
My wife is Kimberly. She's from California, and interesting that both of us are from the West and ended up in the East. She was a nurse. She had a sister who lived in the East Coast in Providence and went to school at BU, so I met her in Boston when I was in training in general surgery.
That's right, because you spent some time up at Mass General. We'll get to that in a little bit.
Correct.
Yes, right. And what inspired you to go into plastic surgery?
You know, I think the first question is what inspired me to go into surgery,
Okay.
And surgery at the time, when I went to medical school, sometimes in St. Louis and Washington University, very strong internal medicine department, and they sort of said surgeons aren't real doctors, real doctors are internists, and so we were sort of steered away from surgery, but I persevered and was fortunate enough to match it in general surgery at the Massachusetts General Hospital, and I've always wanted to do things with my hands. I think most surgeons are hand-oriented and creative, hand-eye coordination sort of things, and want to build things and fix things, and that's what inspired me to do that.
Good. With surgeons, we call the internist fleas. You ever heard that expression?
Yes.
The last to leave the dying dog.
Call the fleas.
Call a flea if you do surgery on them.
Yeah, and it was interesting. At the Mass General, and general surgery was a very sought-after position. The surgery took care of their own patients very often without the internists on board. It was a different era where we didn't have all the specialties. Everybody stepped up. So you had to practice both medicine and surgery if you were a house officer in Boston.
Yeah, and that was a full 5-year program?
It was a full 5-year program. And
your research?
In general surgery, yes. And I took out 2 years after my 3rd year and worked in a surgical immunology lab at Harvard to try to learn the scientific method.
Who was the chief of the general surgery program?
Chief of general surgery was Dr. Gerald Austin, W. Gerald Austin, whose son Jay is now the chief of plastic surgery at the MGH.
Interesting.
He was really the most powerful man in surgery in Boston, and really and remarkable human being for bringing together that program and that's in general surgery.
Well, mention your mentors while we're on the subject. Throughout your surgical life, it influenced you.
So in general surgery, there were two people, the program director, Leslie Ottinger, and one of the general surgeons, Ashby Moncure, and we all wanted to be like them because these guys were the quintessential general surgeons. They did everything. A typical day might be a thoracotomy followed by an aortofemoral followed by a colectomy. You know, so these guys really knew their stuff, and they did it, and it was really a broad field of general surgery. And I think we all emulated them for their length and breadth of knowledge about general surgery.
What year was that?
That was 1976 to 1983.
Okay, so that was at the kind of the specialties were starting to take over.
Specialties, yeah, were not as nearly defined as they are now. You know, plastic surgery at the time, starting out, as you know, was dealt with difficult wounds, closures, things like that. But that was just about the time that the plastic surgery sort of blossomed. You know, if you look back, there were a tremendous number of innovations right at about that time that made plastic surgery much more broad. They included Harry Bunke and microsurgery, Radovan and tissue expansion, Tessier and the whole field of craniofacial surgery, Gerardo Luz with liposuction, Mathis and Nahai working on under your K-Witz at Emory that defined muscle flaps and myocutaneous flaps. So there's a whole bunch of things that were opening up in plastic surgery at the time that made it much more appealing, and sort of just the field exploded with these new options that we had in reconstruction.
Yeah, I agree that it was, when I was my last year of general plastic surgery residency, we did the first reconstruction at Akron City Hospital. And it was a Delta, it was a latissimus flap.
A latissimus flap.
How antiquated.
Yes.
Delayed it, did, you know, the whole, brought it around. And of course, within 2 years, everything advanced.
Yeah, and it was really an exciting time because we figured, like you said, at the time we were using, we didn't quite understand the circulation of flaps, but now we looked at axial pattern flaps and no delay primary transfer because they had a primary blood supply, and that whole field, as I said, with muscle cutaneous flaps, understanding circulation, the angiosomes and everything, just opened the specialty widely.
Right. Yeah, I remember back when it was a 4-to-1 ratio, 3-to-1 ratio.
Correct, depending on the flap where it was.
Exactly, and that's how we based it. And of course, now I'm not even sure residents would understand those ratios.
Yeah,
they just know where the blood supply is and hook it up.
Correct. Right. And so it was really an interesting time. And you look at anything in plastic surgery at the time. If you look in 1967, Tessier presented his work in Rome on craniofacial surgery, and he asked his neurosurgeon. He said, in order for me to fix this, I have to take off the skull and get into the orbit from above next to the brain. And, that had never been done before. Right. And he asked his neurosurgeon, he said, do you think we could do this? And the neurosurgeon said, why not? And hence this whole field of craniofacial surgery was born. And Tessier would go to the lab and go to the cadaver lab and work this all out on cadavers for osteotomies and approaches and things, and then take it back and do it on patients. And I mean, that was a monumental contribution to the way we treat facial deformities,
Yeah. Did you ever, have a chance to work with Tessier?
I never worked with him, but I was very fortunate that when I trained, I had access to a lot of the early craniofacial surgeons that were contemporaries of one of my mentors, Linton Whitaker, and we became friendly. It was a small field at that time, very limited, but I was able to meet Tessier on several occasions. It was sort of the generation before me that once Tessier had defined the field, that made the pilgrimage to Paris, to watch the master and learn from Tessier about craniofacial surgery. And Joe Murray went there, Joe McCarthy went there, Henry Kawamoto, Tony Wolfe, Ken Salyer, all spent time with Tessier, and then had Tessier come and visit them in their own institutions to get started on that F1 generation, as I call them, all of the early craniofacial surgeons around the world that were building craniofacial programs. So Tessier was really a remarkable man. I know Joe Murray actually put him up for the Nobel Prize at one point for the contribution that he's made in plastic surgery. It was monumental.
Yeah. Well, we were lucky, and that's part of this project, is we're not that far removed. Now we are, but back when this started, a lot of these gentlemen were still alive, and we're one generation or less distance from who these people were. When I was in Houston, Tessier would come. He was a friend of Cronin's.
Mm-hmm.
So he'd come and do his 2 or 3 day deal, and they'd line up the cases, and mostly it was for the residents to watch and everything. And it was an interesting, you were watching history.
You were watching history, and the things that have come together. I think Josh Yurkiewicz, for example, was a guy who fostered an environment in Atlanta at Emory for Fouad Nahai and Steve Mathis, along with him, to develop the whole muscle flaps. Harry Bunke, working out of his garage in San Francisco to develop techniques in microsurgery. You have story after story of that, of these people, these really bright, innovative, driven people that really pushed our specialty forward.
And I'm glad you bring that up. And like working in his garage, like Bill Gates.
Yes, exactly.
He figured it out in his garage, and then took it to. But people don't realize that medicine didn't start out with this technology. We worked our way through it. The first microsurgical procedures, you were involved with those. You've done those, and the first ones were crude compared to what we have now.
Yeah, it's remarkable how far we've come, from these clunky operating microscopes to doing it with loops now, on larger vessels, and much more efficiently and much more time. But you're right. It's analogous to the Gates thing about Bill Gates somehow got free computer time at the University of Washington computers, but he only had it at night. So Gates would go spend his night times at the University of Washington computers figuring it out, and made the sacrifice. These guys, these early pioneers, were making sacrifice after sacrifice. They were driven and passionate about what they wanted to do, and they wouldn't accept a no for an answer.
Well, when you said that, you've read Outliers.
Yes.
Yeah, I know. It was a great book.
Yes.
And that's what we had, the outliers that did the things that Gates did that were outside of what normal people would have done. And when I say normal, just these were absolute geniuses and stuff. And they forged the fields that we now work in.
Yes.
So,
that whole plastic surgery milieu in the 70s, 80s, and 90s was just as I said, exploded.
It was the Wild Wild West.
It was the Wild West, and everybody was learning, and it was typical that you'd overdo, do things and go beyond, and then we finally settled down into, this is safe, this is efficacious, this is doable on a day-to-day basis.
I remember you knew Linton Whitaker. I've interviewed him.
Yes.
Okay. And I remember when Dr. Whitaker presented the first subperiosteal facelift. Mm-hmm. And I'll tell you, you can make a face pretty tight doing it that way. And the audience was there looking at it, and it was just the patient He changed the look of the face. He moved everything in a subperiosteal. He said, and Mrs. So-and-so got used to her look over the next 6 months, and we all knew what that meant. She was in his office the first 6 months every day. And when this is, but you're right, you have to go beyond the envelope,
Right.
and then you come back. That's what I love about our profession.
Right.
We're not afraid. If we were, we'd still be doing flaps. Bacamsian flaps and delayed flaps and whatever. So that's the fun thing about the innovation.
I think, my hats off to those innovators who did that, and really took a chance.
Brave guys.
Yes.
Yeah.
Took a chance to do something different that would be a radical disruption of the specialty.
Yeah, yeah. And I think we just touched on this. I'd mentioned before, sometimes we're going to touch on things that I said, you see momentous paradigm shifts in plastic surgery. And I think we've kind of covered those unless you want anything else.
We have seen those paradigm shifts, and it'll be interesting to see what the next 20, 30 years go.
That's the last question. Yeah, it is. And who knows? We have no idea.
You're right.
What do you feel is the most important innovation during your career?
Yeah, so it's hard to say that because, as I said, there's been several. I think, microsurgery brought, really opened and expanded our opportunities. Craniofacial surgery, muscle flaps. I don't think there's been a single one. All of those things have been monumental.
Okay. What do you feel that our greatest mistake as a specialty has been?
I think I struggle most with the fact that we as plastic surgeons have been innovators, like we talked about, but we don't tend to hold on to our innovations. And what happens is that maybe that's our weakness, is we define the problem, we find a solution, and we make the solution easier and easier to accomplish, safer and safer and safer, and then it's taken by another specialty. ENT, oral surgery, dermatology, is taking all of the techniques that were pioneered by plastic surgery. I don't know why we don't hold on to them better. I think people are just moving on to different things, but we keep expanding the field, but don't hold on to what we've really laid claim to early on.
Yeah, and I agree with you, but it's so hard.
It is so hard.
Once the barn doors open, forget about it.
Yeah.
Look at lasers.
Yes.
Yeah. Now there's 10 on every block.
Yes.
That does everything.
Yes.
Yeah. So, is there any professional disappointment you'd like to discuss, or that was,
Yeah,
that's up to you.
It's a hard question to answer because we all tend to make lemonade out of lemons, and take professional disappointments. I think it would have to be related to that, the fact that we haven't prevented the encroachment on our specialty from others in some way. But as you pointed out, it's hard to do that. We're in the business of disseminating knowledge. That's what it's all about.
Right. Right.
Innovating and disseminating knowledge for the betterment of mankind. And I guess it's okay that other people take those on, and if the bottom line is that patients do better worldwide.
I remember years ago, I won't mention any names, although I remember one or two of them, that a doctor who had an office in had a satellite office in California, was going to do a breast procedure. And the surgeon came up to him and said, "You can't do that procedure. I have a patent on it." So you see, there's the bad side.
Yeah.
I'm going to patent this procedure, and then you get into the legality. And he had to do it another way. And of course, he brought it up to the board that this is medicine. This information.
That's not something you can patent.
Right. I don't think they had a fist fight there in the hallway, but he told him you can't do that.
Yeah. Well, I know that there have been instances, I can't cite specific ones, where people developed something the way they did something, and they would keep it as a closely guarded secret. They wouldn't disseminate it, and they would only do, not publish it or whatever.
Well, Obagi.
Yeah.
Yeah, I was telling somebody down there selling a trichloroacetic acid formula, and he didn't know any of the history. I don't know why I was even discussing it with him. But Obagi, do you remember the fees he was charging when he first came out with his procedure? Yeah. Amazing.
Yeah, amazing.
And people paid it. And even more amazing.
People paid it, and it's interesting that we have just, as I said before, we sort of, in the spirit of driving things forward, we sort of give away our secrets, And that's what it's all about, though, because the bottom line is we're trying to improve the care and welfare of patients.
Right. That's our Hippocratic or oath of Maimonides.
And I think it comes with the territory. If you're going to do something new and innovative, you've got to share it, or it's not going to be good for mankind.
And your greatest joy.
Yeah. I mean, if I would tell you that the single greatest joy, one of the greatest joys I have is when I get a 26-inch brown trout on the end of my fly line.
There you go. That's cool.
Because fishing is one of those things, and I have a few friends here in plastic surgery that fish together, that it's one of those things where you wonder why. You go to the same place over and over and don't catch fish, and then one day you hit the big one. It's just that anticipation of, maybe I'll get that one today. Maybe my technique will be just right. Maybe the gods will be shining on me. Maybe I'll have the right fly. Maybe I'll have the right drift. Maybe those brown trout will be feeding right when I need it to. But I think my greatest joy really is, and one of the things that I think people often ask, what would you do if you weren't a plastic surgeon? What would you have done? And the one thing that I've always liked was being outdoors, and I would have chosen something where I could be outdoors a lot more, and because we spent a lot of time, certainly in training indoors, when you didn't see the sunshine for days on end.
Right.
So being outdoors and some activity to be outdoors.
Yeah, that's the fun thing I find about retirement is I always dreamed of what I was going to do. And then I got to the point like it's time to retire. I was just ready. And I thought, now I get to do those things, and had to put them all in the order of what I want to do. Some of them I couldn't do. One of the dreams was I'm going to get up every morning at 7:30 and run 5 miles and do this and that. And I found out, oops, that's not going to work as well. I forgot I'm getting older too.
Yeah, I mean,
but there are other things that we approach. I appreciate
that. It just, I think that there's a lesson in that. I think that you have to integrate that all in your life when you're young and healthy, and get out there. And there's so many examples of people who put everything off till retirement, and then retirement came and they didn't survive retirement.
Right.
In one way or another. So I think you have to get out there, and I've met some remarkable people through plastic surgery that we share time together, mostly in the outdoors, skiing or fishing and things, and you got to do it now.
Yeah.
You never know what tomorrow's going to bring.
I know, particularly in this day and age.
Yes.
Now, who would you say you admire most professionally or personally?
Yeah, I've been very fortunate. I've had some really, really great mentors, and Jim May was chief of plastic surgery at the MGH when I was a trainee, and Jim was really the one who was responsible for getting me into plastic surgery, getting me interest. I used to work in an immunology lab during the day at Harvard and Jim had a micro lab and I'd go over there in the nighttime and work on projects with Jim and his techs, and or go down to the deaner that was doing posts at the MGH and do anatomic studies on things. And so it was really Jim May got me interested, and but there were a lot of people, and for some reason, I can't tell you why, that when I was in training, I sort of gravitated to things facial, even though that wasn't the real purview of the general surgeon, it was more ENT. And so, and when I finished with Jim, I was fortunate enough to have a Atlanta fellowship with Linton Whitaker at Penn and Children's Hospital in Philadelphia to do craniofacial surgery. And and those two people were really very instrumental. But you have to understand, Jim and Linton had a cadre of friends and associates in those areas, and it was through them that I was able to meet some really giants in the field of microsurgery, hand surgery, craniofacial surgery, and they opened doors. Both of them really opened doors for me.
Well, I had mentioned I'd interviewed Dr. Whitaker and Dr. May also, and I remember when I did interview Dr. Edgerton, I did the first one, put all the stuff together. And who was it that said, if I can see farther, it's because I stand on the shoulders of giants?
Right.
Who was that? I can't remember. Was it Da Vinci or?
Yeah.
It may have been, but that's the beauty of what we do is that we share, we learn, we take what we know, and maybe we innovate. And somebody takes that idea and advances the ball down the field a little farther, if you will.
Yes, yeah, and that's always been our specialty, is just keep moving it forward.
So let me ask you your words of wisdom for present and future generations of plastic surgeons.
Yeah, so I think that we talk a lot about this as faculty and with our program directors that oftentimes, and I have two children that are in this generation, that oftentimes the young plastic surgeons think that they should be entitled to a certain amount right when they finish, and I think that you've got to understand that all of this stuff comes with really hard work and really spending a lot of time in the hospital, in the clinics, listening to your patients, observing others, spending the time, reading, integrating thought, going to meetings. This is your main focus. It's more than a job, it's a profession, and you can't take any shortcuts to get there.
I agree, and I've had, last night I had dinner with Mark Constantian, and I interviewed Linda Phillips and Susan McKinnon yesterday. And the thing that we agreed on, and you've touched on, is the hard work of building a practice isn't like it once was. The social media, people come out, the next day they're the world's expert in X, Y, Z.
Yep. Yes.
And they didn't have the fun of going to emergency rooms and taking care of patients and dealing with patients and dealing with families and dealing with failures and dealing with successes and the things that build you up. I wonder and this interview isn't about me, but I wonder what kind of generation of plastic surgeons we'll have in 10, 25 years that didn't have that privilege. We see that at programs. As a resident, you take emergency call, whatever, but it amazes me, people won't be on a call. I met somebody who's in New York. And I said, what kind of calls does he take? Oh, he doesn't take call. We have a lot of new patients because his wife's an influencer.
Yeah.
And it's like, well, you kind of missed the point of this thing. The fun part is taking all the knowledge that you learned at Mass General or University of Washington or Akron City Hospital or where, and you apply that, and that's the fun part. And I think they're missing that. But maybe they're not. Maybe it'll be different.
Yeah, it's interesting to me that people, residents in particular, I've had students come to me. We have a program at Penn where undergraduates can hook up with a faculty in the medical school for a one-on-one session over coffee about just the field of medicine. And I've had undergraduate students sit down and I said, so why are you interested in medicine? And they say, well, I want to be a pediatric craniofacial surgeon. And I look at them and think, you're an undergraduate at the University of Pennsylvania. You don't even know if you want to be a surgeon. You don't even know if you want to be a doctor in the first place. You don't even know if you want to be a surgeon. And you know, I tell them, you know, hold on here, keep a broad perspective. You know, you may get into medicine and find that, geez, I really like interventional radiology, or geez, I really like internal medicine, or I like pediatrics because I want that long-term relationship with a child as they grow up. And I think you really have to keep your eyes wide open, and not focus on anything or have a preconceived notion of what you want to do. It's a big field of medicine, and there's a lot of opportunities, a lot of possibilities.
Yeah, and that leads me into the final question: is what do you see for plastic surgery in the next quarter century?
Yeah, that's a tough one. That's a tough one. As I mentioned, when I finished training, there's all these things, those innovations with muscle flaps and craniofacial and microsurgery and all of these things. I didn't see the whole filler thing coming, you know, about how that is and Botox a little bit because of using it for primary blepharospasm and so forth. But I think there will be continued minimally invasive sort of procedures that are done to prevent major interventions. I didn't see the whole transgender or feminization, masculinization thing coming. I don't know if that's a bit of a fad now, if that will peak and settle down into a reasonable amount. America obviously is getting more and more overweight. I didn't see the whole fat surgery thing coming, you know, as much. So it's hard to predict. I can only tell you that plastic surgery is well positioned to read the tea leaves and see what's in the future ahead. And I think our specialty is filled with some very bright and innovative people, and I think they will see what opportunities there are for patients in the generations ahead. And I think that I feel very comfortable plastic surgery will continue to be one of the preeminent specialties in surgery.
Well, I'm prejudiced. I agree. Is there anything else you'd like to highlight or talk about?
No, I would just say, you know, one of the things that we keep up with is fatigue. You know, there's a lot of people who have gone into medicine who they can't wait to retire, you know, or they can't wait to get out of it, or this phase burnout is brought up a lot about things, but you know, it's amazing to me that, you know, plastic surgery is one of those things that's so interesting and so challenging and so innovative. You know, I don't think burnout's a word we use because we're all so interested in it. We're all so passionate about it. And if you're passionate about something and interested about something, you're not going to burn out. You know, you're going to continue to be very satisfied. Of all the specialties in medicine, I think I'm just fortunate I chose plastic surgery because it's such a wonderful field.
And that's a beautiful way to end it. Every time I've asked somebody that, they kind of go to that mantra. And when I interviewed Dr. Edgerton, I pulled up a lecture that he had given to the Southern Society many years ago. And he said, "We're the rainbow profession.
Yeah,
we do everything. We're all colors." And that's what's so fun about plastic surgery. It gets to the point where you're going to retire, but it's not something you dreaded. Say, I can't wait, I can't wait, I can't wait. Most people stick around longer than they should.
Yes,
because it's fun.
Yeah, it's fun, and it's something that you want to continue. And I mean, I think most of us will carry that passion into retirement when we do retire. You know, and find another activity that's equal as interesting and pursue that with the same zeal and the same passion.
Well, this has been a very interesting interview. Scott, thank you so much.
Thanks. Good to see you.
Good to see you.
Good to be here, and thank you for the time.
Thank you so much, and I hope you enjoyed this interview. All of my interviews are available online at meeting.aaps1921.org. I'll repeat that. meeting.aaps1921.org. And thank you.